Hi Ginger, how are you?
Good, how are you?
Fine, thanks. Thanks for coming in. So tell us what brings you in today.
So I exercise a lot and I've recently had a lot of weight loss and I'm having a difficult time getting rid of the little pooch, the little belly area.
That can really be a problem area. So we'll go ahead and take a look at you at some point. We already know that you keep yourself in great shape. You work out pretty much every day. You had two babies with no previous C-sections. You don't smoke. And the previous surgery that you had left some small scars, but there's no hernia and there's no major scars there.
No.
Okay, great. Well, we'll go ahead and take a look at you and then we'll talk about what the options are.
Great.
So we've already had a chance to examine you while you're laying down, check to make sure you don't have a hernia, check to see if there's been any separation of the muscle, check to see how much skin is loose on the undersurface of the belly. Now, why don't you go ahead and show us what it is that you're concerned about.
So just this center circle kind of looks like a donut just in this area right here, and no matter how hard I work, I can't get it smaller.
Okay, let me just go ahead and feel that. So I'm going to kind of press on your belly here. Now when I squeeze this is the subcutaneous fat, or the fat underneath the skin. That's the fat that can be treated with liposuction. You don't have much visceral fat, which is the fat in and around the stomach and the intestine. And when you feel here, the muscle's really tight. It's really obvious that you work out very, very well. And the scars are minimal and there's no adhesions. And so you'd be a really good candidate to go ahead and do some liposuction in this area to kind of flatten out that subcutaneous fat. And there'd be a little bit of looseness of the skin, but overall you're in great shape, and so I think you would do real well with that. Okay, we're going to go ahead and get started. We are also going to go ahead and harvest the fat. So this subcutaneous fat is great for filling other areas, such as in the face. So a lot of times we'll go ahead and harvest the fat, and you can store it and use it for injection into the face to add volume, similar to like a lot of the hyaluronic acid fillers, where you can add volume to the cheeks, the lips, in different areas of the face, the jawline. We'll go ahead and get started with the liposuction. And with this liposuction, we're harvesting the fat, so we don't use the machine to suction it out. We use a syringe suction. And so we'll be able to get nice fresh fat that, in order to prepare it, there's a few different steps that are taken before it's re-injected back into the patient, so it's concentrated and in good shape for use for filler. And so we're going to just keep going ahead and harvesting fat until we have enough, and then we'll go ahead and go to suction assisted. So here on the liposuction, we use the suction machine, or it's called suction assisted liposuction. We use a cannula, similar size, doesn't have to be any bigger. Use the same stab incision sites for entrance, and I can grab the tissue, and I know that I'm in the right surface here. So a two-handed technique where I can feel the fat that I'm taking out, just kind of move from one spot to the next. And liposuction, if you go too deep, it gets really dangerous. That's why you need to always pay attention to where you're at. You have a nice soft belly that you're working on. And she's awake and tolerating this well. How you doing?
I'm fine.
You doing well? Good.
Yeah.
So we're getting a nice amount of fat out. It's coming out beautifully. And we just keep going from spot to spot and get more fat out.
Thanks.
Did really well. So just taking a look how thin this skin is now, without that excess fat underneath it. Remember how when we were grabbing that before, it was that excess? So that's exactly what we were looking for. So you should have a great result. We're going to go ahead and put a little dressing on you and walk out the door. The only thing you can't do is drive home.
Okay.
Okay.